مساء الخير أهل المغرب. I'm so happy to be here today in one of the most unique cities في العالم, Casablanca. انتوا شعب جميل وناس جميلة, واحنا بنحبكم جدا. طبعا اخويا وحبيبي دكتور احمد منصور عمل النهارده عمل رائع وانا بحبه جدا, بس احنا اكيد كلنا بنحب عمرو دياب اكتر, صح؟ عشان كده ان شاء الله السنه دي كلكم باذن الله معزومين في الاي سي سي اي علشان خاطر نشوف مؤتمر انترناشونال ليفل ونسمع مع بعض عمرو دياب. بيجي لنا ان شاء الله كل سنه, والسنه دي في مفاجاه كمان بس مش هقدر اقولها, حد تاني كمان غير عمرو دياب. اوكي, فكلكم باذن الله تنورونا في مصر بلدكم التاني, وان شاء الله كده نشوفكم على خير دايما يا رب باذن الله. So today I came to you to talk to you about this product from Galderma, and let's remember the only FDA-approved PLLA in the world. Okay? And there is a reason for that. Because at Galderma, we believe in science. We believe in evidence-based medicine. We have a learning curve, and we learn from past mistakes, and we develop new protocols, and we do papers and research on these protocols, and then we start releasing it to the public. Okay. So, what is the real problem in aging? The real problem is before we all thought that the problem in aging is skin laxity, الجلد بيعجز وبيشيخ. And this was our only idea of aging. And we only had very limited tools in our clinics. Fillers, Botox, that's it. وكانت دول the only methods that we can use to fight aging. But as we understand aging more, we understand that aging is not just volume loss, but it is loss of the structure. The integration of the facial structure نفسه is lost. And that happens for many reasons. Not just skin laxity, muscle atrophy, face compartment of fat compartments, they decrease in thickness and they lose the fat. We have ligament becoming loose, and even the bones, resorption happens in the bone. البون بتتشطف. That's why at old people they start to lose the angle of the mandible. The angle becomes wider, the jawline definition is lost عشان البونز. Ligaments, peri-orbital ligaments like the orbital retaining and the zygomatic retaining ligaments, by time بيريحوا ليه? Because the cavity of the skull where the orbit lies becomes resorbed وتوسع. So the bone ages as well. We understand how fat is lost. Fat can be lost from the face not only due to aging, but now we have what we call MDW, which is medication-driven weight loss, like Mounjaro, like Ozempic, like Wegovy, like all the new GLP-1 peptides that you keep hearing about for weight loss. We now also understand that the hormonal level plays a part in aging. When you see the difference between men and women, you will notice that men actually keep getting prettier and more attractive as they age. Men in their 40s and 50s are actually in their peak, not in their 30s. Unlike women, due to menopause, Once they hit menopause, what happens is that the hormonal level becomes affected, estrogen production becomes lower, and therefore aging starts to happen because they lose the fat in their face. So we have to understand that. That's why a lot of women look pretty after menopause when they go through hormonal replacement therapies. And a lot of celebrities are doing that to keep looking as attractive as possible and as feminine as possible in their old age. So these are things that we just need to be thinking about. So when we understand menopause, the biology of it, we know that there is decreased collagen production, and when you reach the age of 30 years old, you start to lose around 1% of your collagen every year. But once you hit menopause, suddenly this number jumps to 30%, which means in the hormonal levels have an effect on that. The elastin اللي مسؤول عن ليونة الجلد, collagen is not responsible for الليونة. Collagen is responsible for the skin thickness. More collagen you have in your skin, more build-up in your skin means thicker skin. More elastin means more elasticity. How do you measure elasticity? By stretching the skin and seeing how fast it goes back to its original form. This is called elasticity. And as we said, of course, there is decreased fat in the adipose tissue and decreased level of hydration, which is why we need still hyaluronic acid products that bring water around from the tissues into a place where they're injected to keep it hydrated. So why do we need Sculptra? We need Sculptra because basically fillers like Restylane are not just enough. Fillers are a perfect tool, and we use them till this day. And personally, I disagree with all the comments and all the thoughts of saying that fillers are going to die out eventually. Fillers are not going to die anytime soon, but they will be precisionally driven into areas where needed. We will not abuse them and keep injecting fillers anytime. Before, if you need volume, fillers. You need contour, fillers. You need hydration, fillers. You need rejuvenation, fillers. But now we understand that we place fillers exactly where we want them. Fillers, however, do not restore the biology. That's why there is no such thing as hyaluronic acid causes biostimulation. There is no such thing as skin boosters causing biostimulation. They can cause what we call bio-revitalization, bio-replenishing, but never stimulate collagen to produce neocollagenoses and increase collagen production by induction of the fibroblasts. وإلا ما كانش حد غلب. كنا خدنا non-cross linked hyaluronic acid وعملنا بيه كل حاجة في الدنيا. Okay? And the improvement that you get from injecting fillers in the skin, the improvement in skin quality is very temporary. Okay? So this is where we need something new. We need a new approach. We need something to stimulate further. We need what we call the regeneration of the tissues, regenerative medicine. علشان the first step to cause age reversal and going back in time is to understand the tissue's ability to regenerate. Okay? So we need to restore the structure of the face. We need to stimulate the collagen production, the elastin production, build up the skin, and by time, improve the skin quality when all these criteria are met. And that's why we have now available, ومبروك عليكم في المغرب, Sculptra. أنا عارف إنه 5 months ago or so, Sculptra has been released in the market, and it is now approved as a medical device, مش as a cosmetic license. And خلي بالكم, it is very important to understand this difference. Most of the products that you have seen in the market, they actually obtain something that we call a cosmetic license. يعني you can use it with a micro needling or derma pen, but you cannot inject it. Sculptra, الترخيص تبعه is a medical device, MDR, and that's why it is an injectable product, رسمي مترخص, and FDA approved كمان. Okay? So, it is the first one. It is the original one. It is the one that all the products that you see, PLLA, PDLLA, PLA, PCLLA, كلهم driven from this technology, which is basically, how many plastic surgeons do we have in the room النهارده? Okay, so you know in PLLA is actually dissolvable surgical sutures crushed into powder. Okay, so basically this is the unique molecule of this. Okay? So what we have is something that we call the 3 U's. The 3 U's in حرف اليو in the Sculptra protocol بتعتمد على ان هو it's universal. Universal means يعني ايه؟ يعني all skin aging in all genetic phenotypes, whether Asians, whether Caucasians, Africans, أو زينا احنا Mediterraneans, it will work. And that's why what we call the 3 U's. The 3 U's universal, it's unique, وطبعا we take pride in saying إنها it's unmatched علشان simply the only one that has achieved enough research to get FDA approval for that as a safety protocol. The 3 needs are, what are the 3 needs that people want from Sculptra? Improvement in skin quality, volume and projecting, lifting, and of course, not just the face, but also in different areas of the body. And we work on all layers of the skin, 3 layers, epidermis, dermis, وhypodermis. يبقى أول FDA approved bioregenerative stimulant for the face وكمان في البادي. This year, Sculptra has been approved as an FDA MDR for injection in the body. Okay? So, we say that skin aging is universal. يعني إيه الكلام ده? We have discussed إنه aging starts من السكن. فlet's take it slowly from epidermis to dermis. طبعا الابيديرمس the outer layer, this is the area اللي بتبان فيها what you see. What you see, you don't see collagen, صح? You don't see elasticity. You see color, you see hydration, and you see fine lines اللي هو textural irregularities. You go down a little bit deeper, mid layer اللي هي الديرمس، دي بقى اللي فيها الفايبروبلاستس في البيزل cell layer of the dermis. This layer is the one that is responsible for the skin elasticity and the collagen buildup of the thickness of the skin. هننزل تحتها تاني شوية، هنوصل للاديبوز تيشو، الوايت adipose tissue اللي مسؤولة عن the structure، النتورك that holds the face together. علشان من غير this glue أو من غير this layer, you will not be able to have something to stick your external structures زي السكين to the deeper layers beyond the mast layer and the bone. هيلزقوا في بعض ازاي؟ هيبقى كل الناس شكلها sagging. فربنا خلقنا كده for a reason. Okay? So these are the layers of the skin, and these are the 3 components of your layers of the skin that will help you understand how aging of the skin appears. يعني حتى السكن we need to understand the different compartments تبعه عاملة ازاي. Okay. So now we have more understanding of collagen and elastin and how they play in the structure integrity of the skin. بس احنا كمان now only we understand that, we now understand what we call the white adipose tissue and its role in the structure. زمان كنا فاكرين انه when you get slimmer in size, you lose fat, your face becomes smaller. But now we understand with aging, deep fat compartments, even if you gain more weight, they don't come back. That's why we develop tear trough deformities. That's why we develop malar areas deformities في aging. Even when we gain weight, بعد كده بتفضل العيوب دي موجودة. So why did it not improve with more volume and more contour even if we gain weight? Okay? So this is something to think about. So when we understand that, and we understand that they play an important role in what we call the skin immunity, we understand skin healing, wound repair, and this is the key to regeneration. This is the layer where the regeneration comes from. عشان أرجع بعمر الخلية إلى ورا. أنتوا طبعاً أكيد كلكم يعني experts وأكيد كلكم متابعين. مين ما سمعش عن كلمة longevity دلوقتي؟ Everybody's talking longevity now. مع إنها موجودة من زمان. صح؟ But everybody's talking longevity now. Everybody's talking peptides. صح؟ Why is that? عشان simply now we understand where these peptides should be injected in order to deliver the best results. كنا الأول in NAD, if you've heard about NAD+, you know about NAD+? We used to inject it IV drips, and then we have peptide shots زي المونجارو والأوزempic and so on. And now we even have formulations for injections in the skin and in the hair. We also have copper peptides. We also have BPC 157, thymosin beta 4, acetyl hexapeptide 8. The list is just endless, okay? So I don't want to talk a lot about that, and I want to go back to understanding the volume loss that we have and why the decreased fat causes this. And this is what we've been talking about. So even when we gain weight and so on, we do not fix the problem. This is what we talked about. Collagen. We understand that there are 7 different types of collagen. بس هم كلهم مهمين. Are all these 7 different types of collagen important? Which ones are the ones responsible for the aging and the structure? هم 2. Collagen type 1, collagen type 3. واحد في الاكستراسيلولر ماتريكس، واحد في الفايبرس تيشو سيبتا اللي هي العواميد او اللي هي البيسك ستراكشر holding the temple together. elastin بيطلع منين؟ من الفايبروبلاستس في الاكستراسيلولر ماتريكس. So we know in elastin is important and it works on aging. Okay? Balancing it out. Weight versus age, سني قد ايه، وزني قد ايه, how much fat am I losing, how much fat am I gaining, كل ده with my age. كل ده بيتحط في الماب بتاعتي او في التريتمنت بلان بتاعتي. and I mean my map اللي هي الخريطه مش الماب بتاعت منصور اللي هي المالتي لاير technique, which is wonderful by the way and we all love it. So as we said, epidermis هتشوف ايه؟ هتشوف الوان، هتشوف pores, هتشوف textural irregularities. Deeper, as we said, هتشوف elasticity, هتشوف ليونة, هتشوف structure. Deeper كمان, loss of integrity and loss of volume to the entire face. Okay? People are changing their needs according to what they see available. يعني when I see something available, I start to think that I need it. هو احنا كنا did we need all to have cameras walking around في التليفونات عندنا? No. But when it was introduced, the first camera on the phone, suddenly we all need it. So this is something to think about. And with the extreme weight loss measures that people do now for a healthier lifestyle, we see للأسف a lot of skin sagging, not only in the face, but in the body. And there are no non-surgical procedures popular enough that used to get effective results زي injectables like PLLA زي السكالبترا اللي احنا بنتكلم عليه النهارده. So as you can see here, in this, for example, the more aging you go through in your curve, you start to have different needs. Okay? So we address problems, face and body. Hello قوي. This is just to tell you the history and the story behind the Sculptra and why it was introduced and why it was invented in the first place. Why did we need it in the first place? علشان ال HIV patients with dermal atrophy, they had no solution for it to restore the volume, and that's why Sculptra was invented في الأساس. بس عشان خاطر it was used as a filler, the reconstitution of 3.5 ml as a total volume had a lot of side effects عشان ما كناش عارفين نحقنه في which layer exactly to avoid these effects and how to inject it. ما كانش حد بيحقن بكانيولا، ما كانش حد بيحقن بالكلام ده كله. We did not understand that. So this slide is interesting because it shows you the learning curve. اتعلمنا ازاي. You don't learn to run unless you learn to stand up first, then you learn to walk, and then you can run. Okay? Here again, this is the 9 stages of manufacturing, how the process itself, where the reason I put this slide for you is to show you simply that it is not a simple procedure. You do not add materials to each other. Okay? 150 milligrams and of PLLA, بس اللي أنا كنت عايز أوريه لكم is this اللي هي ال size of the molecule نفسها. The difference in the size of the molecule. Okay? ماشي. انتوا you guys want to start the injection? شيماء عايزين to start the injection? Okay. خلاص. Okay, I'll make this quick so we can start the injection. We all understand the reconstitution. When we reconstitute it now to 8 mLs, we have seen that the incidence of the side effect have dropped to less than 1%. Okay? This is the preparation for the face, okay? Up to 10 mLs or 9 mLs per vial, and in the body, it's more than double that, up to 17 mLs reconstitution, and you make it hyperdilute, okay? You can add 1 ml of 2% lidocaine to it to make it more tolerable for the patient, and we prefer to dilute it with sterile water. I know هنا في Morocco, it's very hard to find sterile water for injection. That's what I've been hearing. يعني في الroad show اللي عملته كان everybody is saying that sterile water is not easy to get, and that's why sometimes they use saline. Saline, you will need a lot more time to reconstitute it and make sure it is dissolved, but it will work in the end. But of course, the guideline is still sterile water reconstitution. It dissolves better like that. Okay? This is the areas of the face to avoid when using Sculptra. We don't inject it in the forehead. Because you do not have a fat compartment here in the forehead. The skin بتاع frontalis muscle, skin frontalis muscle, there is no fat in this layer. Otherwise, if you gain weight, a lot of fat will come, you will not be able to see because it will block your vision. ربنا خلقنا كده. So we don't inject in these areas where there is simply not a lot of fat. Okay? Again, this is the possibilities of what we can do. Where in the body that we can inject it in the areas highlighted here, buttocks, posterior thighs, upper arms, and even in the hand and décolleté, you can also inject it. Okay. Here it says the levels of improvement and in appearance in the body. You can see after a couple of months. عشان كده when people show you before and after pictures, immediate before and after pictures when using PLLA, طبعا this is nonsense. لأن احنا we achieve the same if I injected even saline on its own. Okay? So we don't judge like that. What we do is we wait for 8 weeks till the new collagenoses process starts, and then we can assess, because the edema from the injection itself.
Excuse me, Dr. Moungy, you have 20 minutes for the demonstration.
For the injection, okay. Yes. I'm a fast injector, ما تخافيش. I just want to make sure everybody understands. This is the last slide. What I wanted to tell you today, وانا جاي النهارده عشان اقول لكم ايه؟ جاي النهارده عشان اقول لكم انه Sculptra is a true biostimulator. يعني ايه true biostimulator؟ يعني it does stimulate fibroblasts to make collagen and elastin. Okay? Hyaluronic acid ما بيعملش biostimulation. بالمناسبة اللي بيعملوا biostimulation هم 3 molecules. Polycaprolactone, PCL, PLLA, and calcium hydroxyapatite. أي molecule تانية مفيش حاجة اسمها biostimulation. سميها بايو زي ما انت عايز، بايو بيلدر، بايو ريبلينشر، بايو ريفيتالايزر، بايو هاكر، اللي انت عايزه، بس not biostimulation. Menopause accelerates aging. Weight loss accelerates structural aging. You can combine PLLA and Sculptra with something like the skin boosters. Fun fact is, do you know that كلمة skin boosters is actually a trademark for Galderma? يعني كل الشركات اللي بتسمعوا فيها كلمة سكين بوستر عشان يهربوا بس من الموضوع خلوها سكين بوستر، حطينا سبيس ما بين الكلمتين، بس كلمة سكين بوستر is an invention of Galderma and it's trademarked. وطبعا if we combine it with Restylane fillers, you have a very nice anti-aging protocols of both restoration and biostimulation. شكرا. I can now start.
Thank you, Dr. Moungy.